The 64th ASH annual meeting and exposition is in full swing as the scientific conversations, coupled with dynamic opportunities to advance research in blood diseases, take place in New Orleans. Let's check in with ASH News TV's Mikkael Lyons, who covered two informative press briefings that spotlight the transformative work happening in the field of hematology.
Two back-to-back press briefings starting with treating blood cancers, changing the status quo. Joining me now is moderator Dr. Mikkael Sekeres. Can you share some of the key takeaways from this press briefing?
Well, one of the abstracts in particular is honestly one of my favorites, which is like choosing a favorite child. So you should never do that with an abstract at ASH, but here we go. And what this abstract showed was that patients who were undergoing a stem cell transplant were randomized to getting a neutropenic diet, which I equate to eating gruel in the hospital, and getting a non-restrictive diet, to look at rates of infections, acute graft-versus-host disease, and actually outcomes. And what this study showed is that patients who received a neutropenic diet and those who received a non-restrictive diet had exactly the same outcomes in a variety of things that were measured. Everything from infections to specifically GI infections, acute GVHD, even remission rates, and eventually overall survival. So that was a fabulous one. Another abstract that I think is potentially changing the status quo is one that focuses on patients who have relapsed and refractory acute myeloid leukemia. Now, these patients are absolutely in a tough spot. They have a very recalcitrant disease, and we tend to treat them with very aggressive chemotherapy to get them into a remission or close to it as they're heading to a bone marrow transplant. Well, in this study, patients were randomized to getting that very aggressive chemotherapy or to getting essentially nothing at all and going straight to the transplant. And the results surprised even the investigators. Those patients who didn't receive the intensive aggressive chemotherapy heading towards transplant did exactly the same as those patients who did receive the aggressive chemotherapy. So the bottom line there, and this will be hotly debated in the leukemia community, is whether or not patients who have relapsed or refractory acute myeloid leukemia actually need to receive that aggressive chemotherapy or not.
Well, Dr. Sekeres, thank you. I mentioned a second briefing that's going to take place, and that one's titled New Drugs, New Targets. So we spoke with moderator Dr. Stephanie Lee, who gave us more insight.
This really demonstrates the breadth of hematology research because we're going to be talking about a blood cancer, we're going to be talking about classic hematology, and then we're talking about a genetic disease, and the treatments that we're going to be talking about are all different. We also have an unusual abstract that's looking at cost-effectiveness analysis. So I think it really demonstrates just, how much is going on in hematology, all of the advances, and then also how we're thinking about actually disseminating all of our advances.